This is video podcast 46 from LearningRadiology.com, Video Flashcards, Most Commons in Pediatric Imaging, Part 1. Hello, I'm William Herring from Albert Einstein Medical Center in Philadelphia. This podcast can be used as an audio-only, video-only, or combined audio and video podcast. The way it works is that on side 1 of the card is the question, in what year did the War of 1812 begin? And then you can pause your computer or MP3 player before going on to the answer. In this case, it's 1812. So let's get started with chest. What is the most common anomaly of the upper airway in a newborn? Choanal atresia. What is the most common side of a congenital diaphragmatic hernia? The left side. What is the most common type of congenital diaphragmatic hernia? A Bachtelec's hernia. What is the most common type of sequestration? An intralobar sequestration. What is the most common type of congenital cystic adenomatoid malformation, CAM? Type 1, single or multiple air-filled cysts usually greater than 2 centimeters in size. What is the most common location of congenital lobar emphysema? The left upper lobe. What is the most common cause of pneumonia in a child greater than 5 years of age? Mycoplasma pneumonia. What is the most common cause of metastatic lung disease in children? Wilms tumors. What is the most common posterior mediastinal tumor of neurogenic origin in children? A neuroblastoma. Gastrointestinal. What is the most common site of necrotizing enterocolitis? The distal ileum or ascending colon. What is the most common site of a stricture from necrotizing enterocolitis? The splenic flexure of the colon. What is the most common type of intussusception? An ileocolic intussusception. What is the most common cause of esophagitis in children? Gastroesophageal reflux. What is the most common configuration of esophageal atresia and tracheoesophageal fistula? Proximal esophageal atresia with a distal TEF. What is the most common site of duplication of the bowel? The ileum. What is the most common site of Hirschsprung disease? The distal sigmoid colon or rectum. What is the most common liver tumor in the newborn? Infantile hemangioendothelioma. What is the most common primary hepatic malignancy in childhood? Hepatoblastoma. What is the most common type of choledochal cyst? A type 1, dilatation of the entire common hepatic and common bile duct or segments of each. What is the most common cause of acute pancreatitis in children? Blunt trauma. Of asplenia or polysplenia, which is more commonly associated with severe anomalies? Asplenia. Cardiovascular. What is the most common congenital cardiac lesion? A bicuspid aortic valve. What is the most common cause of congestive heart failure in a neonate? hypoplastic left heart syndrome? What is the most common cause of congestive heart failure after 2 weeks of age? Infantile coarctation of the aorta. What is the most common cause of cyanosis in the newborn from cardiac disease? Transposition of the great vessels. What is the most common cause of cyanosis in an older child from cardiac disease? Tetralogy of Fallot. What is the most common cyanotic heart disease? Tetralogy of Fallot. What is the most common left-to-right shunt? A ventricular septal defect. What is the most common left-to-right shunt associated with other forms of congenital heart disease? A ventricular septal defect. What is the most common type of right aortic arch? A right aortic arch with an aberrant left subclavian artery. What is the most common right aortic arch associated with congenital heart disease? A right aortic arch with mirror image branching. What is the congenital cardiac disease most frequently associated with a right aortic arch? Truncus arteriosus. What is the most common type of atrial septal defect? An ostium secundum defect. What is the most common type of ventricular septal defect? The membranous type. What is the most common type of total anomalous pulmonary venous return? The supracardiac type. What is the most common type of truncus arteriosus? Type 1. What is the most common congenital heart disease in Down syndrome? Atrioventricular canal defects. What is the congenital heart disease most commonly associated with pericardial abnormalities? Atrial septal defects. What is the most common vascular ring? A double aortic arch. What is the congenital heart disease most commonly associated with asplenia syndrome? Total anomalous pulmonary venous return in almost 100%. Other most common podcasts include Podcast 15 on cardiac most commons, Podcast 21 on chest most commons, Podcast 25 GI most commons, Podcast 38 musculoskeletal most commons, Podcast 42 GU most commons, and the following podcast, Podcast 47, Pediatric Most Commons, Part